Welcome to the East Lancashire Hospital Cerner EPR training video. In this video, we're looking at the revenue cycle application. This video will demonstrate how to check a patient in for an outpatient clinic appointment. Once you have logged on to Revenue Cycle, your homepage will default to Patient Tracking. The Patient Tracking tab is also available to the left of your screen from the Non-Patient Perspective column. The non-patient perspective column will display information which is not specific to a patient. For this video, we're going to concentrate on patient tracking. When a patient arrives at reception, the appointment status will need updating from confirmed to checked in. This will record the attendance and notify the clinician that the patient has arrived. When patient tracking is selected, the default date is the current date. This date can be changed to view any retrospective clinics or any clinics in the future. You can use filters to break down the list. All day will display all the appointments for the list you have selected. Next 2 hours or 4 hours will only display appointments for the hours filter you have selected. You can also quickly search for your patient using Quick View by entering the surname, forename, or MRN. All day is the recommended option, as this will display all the patients that are booked for the appointment list you have selected. The patient tracking list will display patients from the location group, appointment state, and resource you have selected. This list can be updated by clicking on the filter that appears at the top right of your screen. The location group can be changed. If there are too many patients appearing on your list, this can be narrowed down by selecting location, or by entering the clinic resource name. For example, the consultant name can be added, as this will display any clinics associated to the clinician. You can also filter your list to a specific state or status. It is recommended to leave this blank, as this will display all patients. If you make any changes, always click Apply, then Apply and Close to save any changes. From the appointment list, the color status will change every time a patient status gets updated. A purple status means the appointment has been confirmed, but the patient has not checked in. Green indicates the patient has arrived and checked in. The color status will change to grey once the patient has been seen. This is usually completed by the clinician, as they will document any clinical information, select procedure codes, and check the patient out. At the end of the clinic, any patients that are still showing as confirmed will be marked as a no-show by the clinician. Once completed, the color status will change to red. The appointment column will also display the appointment time. A blue circle next to the appointment time means the appointment was booked manually by the hospital. ERS icon stands for Electronic Referral Service, which means the appointment was booked via Choose and Book. The MRN and NHS column will display patient name, medical records number or RXR number. NHS column will display patient NHS number. If an orange circle appears next to the patient name, this is because the clinician has completed an order entry form for a future appointment request. This request will also appear on the work list. Appointment type and duration column will display new and follow-up appointments. Depending on which appointment filter list you have selected, you may have more services appearing on your list. This list is displaying dermatology new appointments. The duration of this appointment is 15 minutes. Duration can differ depending on appointment type and service. For example, a follow-up appointment could have a duration of 10 minutes. The resource and location column will display resource name and appointment location. Depending on which appointment filter list you have selected, you may have more resources appearing on your list. This list is displaying dermatology new appointments at Burnley General Hospital. When a patient arrives at reception to check in, the first step is to find the patient from the appointment list. Click on the arrow key to view patient demographics. Here you can check patient details. Check demographics including GP details and ethnic category. Patient contact details and address. Next of kin details or parent details for pediatric patients. If any of these details have changed and need updating, this can be done when checking the patient in. To check the patient in, click on Confirmed. When clicking on Confirmed, you will also have other options appearing. Did not attend will be available for patients who have failed to attend their appointment. Cancel will allow you to cancel the current appointment and also reschedule. Schedule next appointment will allow you to book a follow-up appointment. Select Check-in to record patient attendance. When checking your patient in, always make sure you have selected the correct patient. The arrow key on the right of your screen will display further information such as NHS number, gender, age, and date of birth. The ethnic category will display a green tick if this information has been obtained and documented. The ethnic category will display a cross if this information has not been documented. The OK option will also be greyed out as this information needs to be documented. Make sure the check-in date and time is correct. A green tick will appear if the patient has arrived early or on time. A red cross will appear if the patient has checked in late. Check consultant details and demographics. If the patient details are correct and ethnicity has been documented, click on OK to check your patient in. Click on OK to modify and update patient details. You can now update patient details. Any fields that appear yellow or with a red asterisk are mandatory fields and will need completing. When selecting Hospital Trust, make sure you have selected the hospital location and not East Lancashire hospitals. Any fields that appear in purple are recommended fields. This information is useful to capture, but not mandatory to complete. Always make sure the correct ethnic category has been obtained. If the address needs updating, either modify the address or add a new address. Ensure contact details are up to date. Check GP details. The magnifying glass will allow you to search and update GP details. Click on Relationships and Schools tab. Here you can add or update next of kin details. School details will need adding or updating for pediatric patients. If you have added or updated any information, it is important that you save any changes. Patient tracking list will now show patient status successfully updated to checked in. If you do come across any patients that have been checked in by error, click on Checked In and select the Undo Check-in option. This will change the status back to confirmed status. Thank you for watching this e-learning video. Further resources are available in IT systems training on our Trust intranet.